Hello everyone, I'm going to talk about the adaptive leadership. So adaptive leadership is about how leaders encourage people to adapt when facing problems. And the goal is to encourage people to change and to learn new ways of living so that they can overcome challenges and grow in the process. According to our textbook, adaptive leadership assumes a service orientation, which similar to a physician who use their expertise or the authorities to serve the people by giving diagnosis and helping them find solutions. To be an adaptive leader, APRNs must be able to adaptive first. Scope of practice for APRN is different from state to state. APRNs in Texas and California only has a restricted medical practice for APRNs, which means we have to operate under the physician's oversight to give diagnose and treat patients. However, some other states like Washington and Nevada authorized APRN's full scope of practice without any physician oversight. Regarding the different scope of practice authorized by the different state, as a leader, APRNs need to be lead by example and well adapt local and state regulations. Association of American Medical Colleges stated by 2030, a shortage of a physician will be between 15,000 to 50,000. And at the same time, the shortage of non-primary care specialties will be twice as much as the primary care. And this creates problems in quality of care to our patient and also increase providers' workload and can reduce their job satisfactions. But according to American Association of Nurse Practitioners, 89% of the nurse practitioners participate in the primary care. So, as an adaptive leader, APRNs can help to step up by taking the primary care role from physicians and free their hands to specialties. And in the same time, we can increase the quality of care for our patient by combining the roles of a provider, mentor, and educators. Another perspective is the cost of medical expense. It's always a concern for patients and their families. To help patients with this problem, APRNs can educate their patients that we are capable to provide the same level of care in the primary care setting as the physician does, and at the same time reduce their medical expense. According to a study done by Hamel and Prezat in 1994, and they found that compared to the cost of physician-only teams, the cost of a physician and nurse practitioner teams in long-term care facility was 42% lower. From the team-based care perspective, APRNs can serve as a bridge between doctors, nurses, pharmacists, and physical therapists, also the patients. So the patient is the center of the healthcare team. Most APRNs has quite a bit of direct patient care experience as an RN, and they are able to communicate with doctors, pharmacists, and the patient on a daily basis. As an adaptive leader, APRNs can help patients to establish goals and collaborate with physicians with treatment plan. Through interactions between all healthcare providers to make the best decision for our patients. So my question is, what can you do if a physician has put a discharge order for a patient, but the patient feels that he or she is not ready to go home yet? Okay, thank you everyone. Bye-bye.